On January 30th, 2020, the World Health Organization declared the coronavirus outbreak a public health emergency of international concern. The number of confirmed deaths from the virus worldwide is over 3,400, and it's reached almost every continent. Yet some people have little information on the subject or a sense of preparedness if this were to grow into a pandemic. Ashley Budenhagen, a clinical pharmacist practitioner at the St. Regis Mohawk Tribe Health Services, compares the coronavirus to more familiar illnesses.
The coronavirus this year they're referring to as a novel coronavirus, which means that it's just one that we've never seen before. So the coronavirus has actually existed. The common cold, the usual cause, is actually a coronavirus. So this is just a new strain that we haven't seen before. It is similar to SARS. That's the most similar that they're comparing it to. And they believe it actually originated from a bat coronavirus that has now translated over into humans. Coronavirus and the flu are both obviously viruses, similar transmission, similar symptoms. The major thing now is we know a lot about the flu. It's been around for a while. The flu is still a large concern, and the coronavirus, we just need to learn more about it and follow the same precautions to try and minimize the spread.
According to the Center for Disease Control, as of March 5th, 2020, there are over 100 confirmed cases in the United States. So it's important to be aware of how the disease is spread.
So the virus spreads typically through respiratory droplets, so coughing or sneezing, similar to the common cold or the flu. There's still some debate on whether it can live on a surface and how long it can live on a surface. Other viruses can live on surfaces, 24 hours, but they're not really sure with this specific strain. The precautions would be similar to what you would do with the flu: frequent hand washing with soap and water, using 60% alcohol on your hands if you don't have access to soap or water, maintaining your distance from other people, especially if they're ill. If they're ill and coughing, they usually use a 6-foot rule. If you're sick, they certainly want you to stay home from work or school and avoid transmitting to other people. So the typical symptoms are fever is associated with about 90% of cases. The other common symptoms are cough, runny nose. Only in a very small percentage does it become a severe respiratory problem where you have a lot of difficulty breathing, but sometimes with mild cases there can be a little bit of shortness of breath as well.
If there's a concern over symptoms, especially if you've traveled recently to destinations with heightened exposure, start by contacting your local healthcare professional for guidance.
So what happens if they think that somebody needs to be screened for the virus? We contact the local health department and the CDC, and the only place currently in the United States that can test for it is actually the CDC. So we would contact them and let them know we have someone under investigation, is what they call it, and they would determine if we should be testing them or not. We would collect the samples and then send it to them for testing.
For more information on the coronavirus, visit the Center for Disease Control and Prevention at cdc.gov.